Hey mamas, cracked nipples are no joke for anybody. In fact, it's probably one of the leading causes of a disruption in your breastfeeding journey and sometimes even stopping breastfeeding. Now, considering that they very often happen right in the beginning, I want to make sure that that doesn't happen to you. So in this video, I'm going to help you to understand some of the causes of cracked nipples, what you can do to prevent them, and then some effective treatments to help you to treat them so that you can enjoy your breastfeeding journey.
So as you're watching this video, I encourage you to place your tongue directly behind your front teeth. And that area is the hard palate. If you move your tongue further back to the soft palate, that is the area in your baby's mouth that needs to be where your nipple is placed when they are breastfeeding in order to prevent cracks. You also want to make sure that when your baby comes to the breast, they come in with their chin and lower lip first so that their head is tilted slightly back. And then you tip their head forward so that they bring more of the nipple in and so that it does get into that soft palate comfort zone. And by doing that, ensuring that there is no friction directly on the nipple, which is what causes those cracks and damage. If your baby has a good latch, there are three very distinct things that you will notice. The first is that the baby's tongue, which you can't see, but the tongue is able to extend beyond their gum and reach around the bottom of the nipple in order for it to massage the nipple in order to get the milk to start flowing. The second thing is the baby's lips are flanged around the nipple. And the third thing is that the nipple has been drawn far enough into the baby's mouth that it is not grazing on the top of your hard palate, but rather it is in the soft palate as you saw in the previous animation. Now, the things that will sometimes impact that could be a tongue tie or a lip tie. And a tongue tie is when baby's tongue is still connected with a tiny little piece of tissue. And what happens with that piece of tissue is that it impacts the tongue's ability to move forward and to do the correct massaging technique. So the baby is essentially unable to grasp onto the nipple. And because of that, the mouth and the lips are unable to flange and open, and the nipple is unable to go deep enough in the baby's mouth, which causes pain, discomfort, and ultimately cracks. If, however, it is a lip tie, meaning that the tongue is okay, but the top lip, there is that extra piece of tissue, the same thing will apply because now the baby is unable to grasp and hold onto the nipple effectively, and the nipple is therefore unable to go deep enough into the baby's mouth. And in that case, now the tongue is also unable to do the effective massaging. And all of those would impact the baby's ability to get enough milk, to feed effectively, and will also ultimately cause damage to the nipples. It's very common that on the day when your milk comes in, which is usually day 3 or day 4 of your breastfeeding journey, that your breast will become full, heavy, engorged, and very tender to the touch. This fullness can make it more difficult for your baby to latch, especially if your nipples were fairly flat to begin with. The full breast will tend to flatten the nipple out even more, and the breasts are so hard that the baby is unable to take a good enough mouthful and for the tongue to extend beyond the gum and massage the nipple effectively. So engorged breasts can very easily lead to a bad latch. I recommend that you have a trained and experienced lactation consultant with you from day one who is able to guide and assist you on how you can latch your baby, ideally without actually doing it for you. Remember that the lactation consultant is not able to go home with you, so it's important that you know how to position your hands, how to position your baby in order to get a good latch. Another thing that can also easily damage your nipples is the incorrect use of a pump, specifically if you are using the incorrect flange size when you are pumping. Once again, I recommend that you get a lactation consultant who guides you as to when to pump and to have a very good reason for your pumping. Too often, pumping is used for all the wrong reasons and causes problems that could easily be avoided. Silicone nipple shields can be incredibly helpful if you are struggling with a bad latch, but please remember to only use them under the guidance of an experienced lactation consultant who can help you to use them effectively for all the right reasons. My number one recommendation for treating cracked and damaged nipples are Silver Mama nipple cups, but please remember that they cannot fix a bad latch. So only start using them once you have fixed the latch, and you will see a visible difference and feel a difference within 24 hours of using the Silver Mama nipple cups, as long as you have fixed the latch. If you do not feel and see a difference, then you need to be seen again by a lactation specialist who can guide and assist you to fix the latch or to assess for a tongue tie or a lip tie. More than anything, I encourage you to get help early in your breastfeeding as soon as you discover that there is an issue with pain, cracks, or damage or your latch, so that it can be addressed and fixed and you can continue to breastfeed. Remember to join our WhatsApp group where you can ask all of your questions and get personalized video answers from me, the virtual midwife, Karen Wilmot.